Okay, I want to show you. Now, you remember when I told you about if the person has problems with rotation, you do what they call the Pnf stretching, you know, this sort of thing, pushing against it, that sort of thing, right? I want to show you two things. One, a technique for, you know, someone gets what they call a crick in the neck. So they come around, they go, oh, yeah, no, I feel it, but yeah. This client, now remember, this is going to give you, I'm going to give you something that's really great to do as a treatment technique when you're in, let's say you did your massage, this sort of thing, whatever treatments you did, this is a great one. If they get off the table and they still go, yeah, no, it's better, but I can, right? So they're having problems, let's say, rotating to the left, okay? First of all, I'll give you, this is a home exercise. So let's say the person, you gave them that exercise, but it's still it's kind of too sore. So you might find, and this is specific if the pain is up in the neck area here. Very often they might come out, but it's down here. This is not so much for that. It's if they go, and you can palpate the neck, like where, or get them to ask them, you know, where are you feeling that pain there, right? So very often there'll be spasm and or a locked up joint, right? So the joints, when you turn to the left, sorry if you already know this, if you turn to the left, so we've got your occiput, they start rotating, and it sort of just keeps rotating down, right? All going well, but if they get stuck, so this sort of goes, oh, or if there's spasm, right? And quite often there'll be the two, it'll lock up because of a stuck joint to protect the area. Right, so knowing that we want to get that joint moving, okay? So let's say, I'll show you the treatment technique first, okay? So this would be something I would do, well, you could do it before or after the massage. I'd probably do it after. I'd just work it, do the treatments, the gua sha, the whatever, and see how they, when they get up the table, and all the other things apply. But let's say that you gave them the exercises, but there's still pain, or this is a specific person that goes, it's worse on rotation, okay? This is a technique to still do the double chin. All that applies, right? They're your first exercises. But, okay, so, right, I'll show you. So what you can do, and I would generally have them in a sitting up position. If you've got them lying down, you can just use your finger as you're going to rotate the joint. I'm going to show you sitting up so you can see what I'm doing. So if I had someone, you. So you're sitting there towards me, looking at me. So you said you're having problems turning it that way. So I'll be the mirror image. So turn that way, which means this joint is not. So if I have problems here, that joint is not rotating around like it should. So what do? First of all, you find you can do this on yourself right now. So find that area where it's painful. Okay. So what you're going to be doing, you're going to be on the side, so you're going to make it come around that joint. So you're mobilizing the joint. So, okay, I've got problems here and the pain is here. So I'll show you what I'll do. So if you were to do that, I would be having my finger, for example, on that area that you said was painful, getting you to rotate and guide you sort of like this as we're working around, in mobilizing, making sure it's not painful for them, not too painful, just, you know, as you're pressing on to get that to rotate. I'll show you. So here we are. So I'll say this is the level, say C4, and it's painful here, and I can't do it. So what you can see, I'm working it around. Now, of course, you could, if you've got the person there, you can ease with their head like this. Okay, this is not so we're mobilizing the joint. I want to just show you just tell you what I just did then. Okay, so you know what I did, and I'm doing that, and I'm helping with the head. So you would do the same if you're sitting up. If you had the head in the hand at a supine position, same thing. You'd have your finger on that joint, and you get them to rotate, and you could help cradle the head as you come around. You understand that, don't you? It's not difficult stuff. Okay, so, but what I did here was went from 0, with the pressure on, comfortable for the person, and I did a few like that, coming into range, like to increase their range and get that moving. Okay, I did that, right? And then what we call end range mobilizations. So what you can do then, so let's say you warmed it up, you get that, you could test them if you want. Okay, see how that goes? Oh, that's way better. Okay, yeah, right when I get on the end, there's still a bit there. Whether there's or not, but so then you're going to do end range mobilizations. Okay, so what we're doing, same thing. So you did this here, and you would have seen me do this. Come round, and then get to that end range, and same thing, pressure on, but there's short amplifications, right? Okay, I just spin around so you can see it again. So what I'm doing, I did start off with the whole range, getting to the end. And of course, you'd say to your client, look, let me know if there's any pain, let me, just nice and comfortable, bringing it round. So you can see this would be this if you had them in a supine position. Okay, obviously you can't do it with the face down. So I'm just going to show you those again. So you look at, I'm doing full range, and then I'll do just ones at the very end range. So full range first, end range at the end. By the way, so I'm on this right hand side to push it around, okay? I mean, you could try and come on this side to put, but it's much better if you're sort of pushing it round. It's much easier, otherwise it gets all grabby in the skin and so, okay, so full range and then end range. That is an awesome technique that you can get, that you can do in the clinic for those clients that have that rotational problems. And if you find that that's up in the neck, again, there might be quite often it's down there. Well, that's not going to be so easy to do. I mean, if you've got palpation skills where you can tell lack of movement in specific joints, well, all the better. Then you know what to do. Right. So if that was the case, and the person still might want to stick up again. Okay, you can get them to do that same thing in the clinic. Right? Teach them in the clinic for them to do at home. Just get them, so you do that on them and you'll explain. So just kind of roll up a little microfiber. If they've got resistance bands, you can use that because they're a little bit grippier. But all you're doing is, I guess they could do it. If again, you got to check on your clients. Some clients would be able to, they're very tactile, so that they might sort of, oh yeah, I know what to do. I'll put my fingers in there, and that's what I do. You can explain that what I've just done. Or again, if they've got sort of, it's hard for their shoulder or something, and same thing. So you're doing that with the towel. So I'm pulling this side, okay? Same thing, but then. And I'm pulling this one. This is just there to, so it doesn't fly away. Okay, but the pulling is this one. Okay, and the same thing, you can get them. I'm noticing I'm getting a lot more range of movement. I should be doing this more often. Okay, so now I'm pulling this. If it was the rotation to the right, or both. All right. Sorry, I got some dust in. I think it might be dusty. I think making my nose itch. Okay. So just think along those lines. That's something you can get your client to do. Okay. Look, if you're talented, you know what you're doing in this. You can even do that with Pnf, like with the stretch resist. Okay, like I did this one here. But you could have that round. Okay, so you do that, and then you could sort of lock it up with this side, get them to turn back. And relax, and bring it to the next point. I'm putting that out there. It's a fantastic technique. If you can do it, so I'll do it to this side. So same thing. So you're getting them to come around. You got fingers on the joint, on the painful area. They're coming round, and then you can get them to rotate back. Okay, 3 to 4 seconds, whatever. Breathe in, breathe out, and then bring it round. as you're still using your finger to bring it round, okay? So they're great techniques that you can really help your clients, especially when you have those pain on rotation and most definitely with restriction. If you can find where it's restricted, that's generally where it's painful. Again, if there's not pain on like on the movement, then palpate down and go, okay, are any of these particularly sore? Okay? Or as I say, if you can tell, you know, your spinous processes, your fat joints, you can tell, you know, restrictions like that one right there. You feel it pop up, so it's not moving properly. I've got a bit of work I've got to do on myself here. So, yeah. So again, that's just really down to your palpation skills, your skill level in general. But that's another tool in your toolkit.